Hello and welcome to North Dakota Wellness Chats. This is an educational initiative between the School of Medicine and Health Sciences and the North Dakota Department of Health and Human Services. My name is Dr. Grace Kakari. I go by Dr. G, and I am with the School of Medicine and Health Sciences, University of North Dakota. Please meet my co-host.
Hi, and I am Dr. Kristen Zhao, and I am with the North Dakota Department of Health and Human Services, and we are excited to talk breastfeeding this month. So, welcome.
Welcome.
August is National Breastfeeding Month, and we are so excited to be joined by Kim and Mikaela with our maternal and child health programs. And today we will be talking about all things breastfeeding. And so, Kim, Mikaela, welcome.
Thanks.
Hi, thanks for having us.
Absolutely. Do you want to tell us a little bit about what you do? Mikaela, you can start.
Yeah, hi everyone. So I'm Mikaela Schlosser, and I am the maternal and child health nutritionist at the North Dakota Department of Health and Human Services. So I work with our statewide partners through local public health and hospitals to help support moms and families with not only initiating breastfeeding, but how they can continue up to at least 1 year, the first year of the child's life.
Awesome. Thanks, Mikaela. Kim, how about you?
Hi, I'm Kim Hinnenkamp. I also work with the North Dakota Department of Health and Human Services, and I work with the WIC program, and I provide services to our local WIC agencies across the state to promote and support breastfeeding. We do provide support to breastfeeding moms up to their child's first birthday, and so I work with our local agencies to help provide that promotion and support to our families.
Excellent. Thanks, Kim. So just getting right into it, some of the data around breastfeeding in North Dakota is quite interesting to me. One of the things that we know is like we have really good initiation rates. So at birth, at the hospital, we have nearly 90% of women initiating breastfeeding. But what we then find about 6 months later is that only about a third of women are currently breastfeeding. And so I'm curious, like, what do you think may be explaining that difference between those two rates?
I can start, and then Kim, if you want to chime in with insights you have from the WIC participants. But a lot of what we see when we work with our local partners is that it can be a couple of things. So becoming a new parent can be challenging. You have a lot coming at you, and how you feed your child can seem very stressful in the moment. And so for a lot of moms in our rural areas, they might not be able to have access to close lactation counselor support when they run into issues. And so having that support and just having someone there that's able to help guide you through the breastfeeding journey is really important, and something that we're working really hard with our local partners to help expand and increase. So when moms leave a hospital, they have somewhere to go for questions and problems that come up. Another thing that can be an issue is returning to work. So when you return to work, it can be another kink in your breastfeeding journey, and knowing how to navigate the support that your employer can provide, how to have a conversation with your employer, and just really what's out there to support you are, again, areas that we hope to increase our support for moms in North Dakota.
Yeah, and also I would say for WIC, we see our moms, hopefully they come to us when they're pregnant. And so then our staff do a lot of talking with moms about breastfeeding to get them ready for their breastfeeding journey once they have their baby. But then again, like Mikaela mentioned, it's that support that we do provide at WIC, but making sure that they connect to us as soon as possible or whenever they're having issues, either during the hospital stay or right afterwards, so that we can help them to navigate those issues, but then also, regardless of whatever issues they're having, also to support them wherever they're at. So whatever their breastfeeding goal is, that we make sure that we're helping to support them, whether it's 1 day, 1 week, 1 year, that our staff are there to help provide any kind of support that they need. They just need to connect with us and keep communicating with us, because our staff are always there willing to help support them in everything that they need to make sure that they reach their specific breastfeeding goal.
No, amazing. Thank you so much for sharing that. So you both talked about how it's important to support new moms, but why is breastfeeding important in the first place? Why can't I just go to the store and buy my formula? Why do I have to sit, hold the baby for several hours? And I'm speaking like that because I'm currently breastfeeding. I just had a baby 2 weeks ago, and sometimes at night I wonder why I'm doing this. Why? Walmart is just around the corner, so maybe I need to know why.
There are many health benefits to breastfeeding, which is why when many moms choose to breastfeed, they're benefits for themselves, for the mother specifically in terms of breast cancer prevention. There's benefits for the child right away. There's benefits from prevention of infections, sudden infant death syndrome, some of those things, and then health benefits for the future, like diabetes prevention and childhood obesity. Other reasons that I hear a lot from our WIC moms about why they chose to breastfeed is outside of the health benefits, but it's really that bond that they feel that they have between themselves and their child. And they'll note that if they hadn't breastfed other children and have breastfed their current child, that they do feel a different bond with them. And so it's one of those outside of the health benefits is a great reason to breastfeed.
Awesome, thank you. Mikaela, anything to add to that?
Yeah, I think one thing that a lot of families can find beneficial too is just how amazing our bodies are and that we're able to adapt to our child's needs. So that immunity, a mom will pass her immunity over to her child. And, if the child is sick, her body is going to adapt to be able to help them work through that. And so, immunity is a big part that's a benefit from breastfeeding that you might not be able to get from other sources.
That's an excellent point, especially in the wake of COVID. I know there has been some significant research on the differences between women who breastfed and passing on immunity to their infants in that first year. So great points.
And I think just one thing to add too, because just from a personal side, I was someone who did struggle with breastfeeding. And so just a reminder too, that any bit of breast milk you're able to give your child has an impact. So just to remember that, sometimes it's best if it's only breastfeeding, but if what you can do is as much as you can do, just be encouraged by that.
Yeah, that's an excellent point, because I think the other thing that sort of gets lost in the mix of the discussion of some of these recommendations is that it's hard. It's not something that if everyone could do it and it was fun and enjoyable, then we would all be doing it. So that's a really, really good point to note. But I'm curious about, you mentioned, the bit about one of the barriers to breastfeeding cessation could likely be women going back to work. And the role that employers play in some of these, outcomes that we see. And so I'm curious a little bit about what are we doing as a state that would be, essentially trying to impact employers to be on, I don't want to say the right side of history, but essentially to encourage employers to support new moms in their breastfeeding journey.
Yeah, so the North Dakota Department of Health and Human Services, since 2009, it was written into our legislature, but our program started in 2011. We have what's called an infant-friendly workplace designation. So it's when workplaces adopt policies that cover how a mom will be supported when she comes back to work with time to pump breast milk, appropriate space that's not a bathroom, and then access to a sink and refrigeration. So sink to wash off the breast pump parts, and then refrigeration to keep the milk cool and safe throughout her workday. And so we do offer employers support with identifying how they can support their moms, because it can sound daunting, but what we've found by having, I think, up to 170 workplaces now who are designated, we have found that a lot of times they're thinking it needs to be this big grand space, or the mom is going to be going to this space a ton throughout the day. And so just helping provide the education that, it really does not need to be anything permanent. It could be a flexible space that's used for meetings, but available when the mom needs it. And just helping them navigate what's going to work best for their situation to support moms. But then also at a federal level, there was a law passed this past June. Is that right, Kim? Dates are April. So this last summer, there was a law passed, and it's called the Pump Act. But it provides support through the FSLA for pretty much all employees to be supported with time and space when they return to work.
That is fantastic. Thank you
Yeah.
for sharing that. We did mention support, but can both of you take turns in telling us the specific support you provide for moms? So maybe two or so resources that if somebody's listening to it, the person knows that if I go to Wake, I would get this specifically. If I go to this other office, this is what I'll get. So that would be great.
Okay. So I can start at WIC. We really like to have our moms come to us when they're pregnant, obviously, because then we can do pregnancy education and breastfeeding education if that is what the mom is choosing to do after she has her baby. So that's like I said, that's really important for us. But if the mom isn't on WIC during her pregnancy, she can still come to WIC after she has had her baby. And then the staff will provide breastfeeding support in terms of education. We also provide additional foods for our breastfeeding moms, and they can stay on the program longer. So they can actually stay on the program up until their infant is 1 year of age, versus if they're exclusively formula feeding, then they are only able to stay on the program up until their infant is 6 months. So the other thing we do provide at all of our agencies are access to breast pumps. So we have breast pumps that can be loaned to participants. Obviously, the staff are very well trained, so they can help support the mom in learning how to pump if that's something that she needs at her workplace, or if she has a special needs child that's in the hospital still, we can help with that. The other thing too, at some of our agencies, this isn't at all of them, but we do have a peer counseling program. And what that is those, we hire basically their peers to the moms that are available for support 24 hours, 7 days a week. So they can contact them in the night when they're having trouble, on the weekends, when they're having trouble, to get that basic breastfeeding support. And then if it's outside of the peers' scope, then they have breastfeeding consultants they can refer to for additional support. So we provide a lot of support to our moms in terms of food packages, breast pumps, education, and other support over the course of the pregnancy through the infant's first birthday.
Awesome. Thank you. Mikaela, anything from your end?
Yeah, a lot of our programs are more population-based, but things that I can think of specific for moms would be, again, if you're returning to work and looking for resources on how to navigate that process or how to have a conversation with your employer, our website has a lot of great resources, specifically under our workplace tab. And it says resources for moms, and you can click on there to have access to, there's a tip sheet on how to have a conversation, what kind of items you should highlight. But then there is a link where you can say contact us. So if you're needing additional help, then you can submit through our contact us website, and then we'd be able to help you get connected with either local resources or resources at the state level. Also through our local public health partners, not all of them, but at least 9 of our local public health partners, they do receive funding from us to work on breastfeeding in the counties that they serve. And so just connecting, reaching out to your local public health unit to see if they are providing any breastfeeding resources would be another avenue for support after you leave the hospital.
That is excellent, you guys. And, I think this sort of like circles back to where we started, which is obviously if it was easy, we wouldn't need all these supports in place. And it's so great to hear that, they exist and they're available to everyone. And so can anyone just, I think for local public health, can any mom just walk in? I know WIC has a specific criteria, but can any mom just go to any of the local public health agencies?
I would defer to contacting that local public health unit before you go in for services, just to have them provide you with the information on, maybe what you need to do to prepare for an appointment. But most of them do provide services to any mom. There's not an eligibility that I'm aware of.
Excellent. And my understanding is that all the birthing facilities also have lactation support as part of their package, at least in the hospital. Yeah.
Yeah, most of them do. And that's an area that since I started 7 years ago, we've seen growing a lot. And so it's encouraging to see how a lot of them have expanded the support they're able to provide, especially in the rural areas when I know they're really working hard to make sure that they have staff who are trained specifically to provide breastfeeding support.
Awesome. Well, thank you so much. I think those are my questions. Grace, I don't know if you had any additional questions.
Well, I guess one resource I can also add is that you may be able to get breast pump from your insurance. Yay!
Oh, that's a big one. Yeah.
Yeah, so that's where I got my pump from. Like, yay, thank you. Just that you have to also check in, like Mikaela said, there are some pumps they will cover, there are some pumps they won't. So you have to make sure you know the one within your insurance package and then work with them appropriately to get that. So,
And Medicaid also provides coverage for breast pumps. But if a family's on Medicaid, they also would be automatically eligible for WIC. And so it's a great resource for them to get connected, as well as if they're on SNAP or TANF, they would automatically be eligible for WIC. As Grace mentioned, we do have income requirements for WIC, but they are higher than other programs. So even if you wouldn't qualify for Medicaid, you may still qualify for WIC, and all of our income guidelines are on the website. But we do have offices or satellite offices in every county across the state. So no matter where you live, you should either be able to either get access in your county or maybe go a little bit further to the main site. The other thing that we're doing too since COVID is we do have a lot of options for remote appointments. Now that wouldn't be for like the initial certification appointment where you would see if you're eligible and get on the program. But after that, there are a lot of services that are provided remotely. So that would be like over the phone. And so if transportation is an issue for you or just work schedules or other things, staff can do appointments, subsequent appointments afterwards by phone or and in a time that works for you. So we have a lot of great options now to meet participants really where they're at once you get certified and get on the program.
Fantastic. Thank you. That's wonderful. Yeah, I think we are going to wrap up here. And if you all have final thoughts and recommendations for anybody who may be considering breastfeeding and possibly going through some of the challenges we've spoken about, or still not sure about it, or maybe just there, but just about giving up. Some of us, we are just there. I'm almost there. So, any final recommendations, takeaway tips for us would be great. And we can take turns in doing so. Ken, would you like to go first?
Yeah, I would just say, when you talk about if you're thinking about, where you're at or you're frustrated or thinking about quitting, I would just, reach out to somebody else you have for support and just ask them for help, talk with them about it. As you mentioned, we have so many moms that have initiated breastfeeding. I'm sure that there's somebody in your support system that could give you some guidance, help, and support. And then also, like Mikaela said earlier, any amount of breastfeeding is beneficial. So whatever you feel like meets your goals for this baby and this time around, that's great. The next time is a whole different experience, and you may have different things that work better or for you in that experience. But just like I said, reach out for support. There's a lot of help available. Even just reach out for encouragement to find out that you're doing a great job is just really, really helpful and can really help make it through another day maybe or another week or something like that.
Yeah, and I would say, we've talked a lot about professional support, but don't forget about your just family or friends support network and bringing them along with you. So a lot of times just having a conversation with them and explaining, this is where I'm at, here's where I need support, because their encouragement, they're going to be there most likely when you need it the most. And so having that, identifying those people who can pick you up and help you just encourage will be really important. And just take it day by day when it gets to that point where you're wondering if this is right, just day by day in those first few months, and hopefully it gets easier as you keep going.
Yeah. And it doesn't make you a bad mom if you're feeling like, it's hard. It is hard. And yeah, so I would don't feel the shame or the guilt.
Yeah.
Yeah.
Yeah, wow, this is great. I don't think we talked about how long people should breastfeed because we hear of exclusive for a certain period of time, and when you're talking about anything works, anybody wants to mention that? Or
Yeah, so the recommendations from most health organizations is to exclusively breastfeed for at least 6 months. And so exclusive means no other, water or source of food for the first 6 months. And then after that, it can be up to 2 years as long as the mom and child desires. So
it's good, but you just do your best. No guilt, no shame. There is support, right? There is support around us, and just seek help. And it's
mhm.
painful. Nobody's painful, but seek help. There is hope, and there is balm to put on it. Dr. Grace, anything else before we say goodbye to our dear friends?
I know this was really great and super helpful and super informative. Like I always feel like I don't even know half of the resources available out there. So I think throughout this process, I don't know if that's been your experience, Grace, but I feel like I just learned about so much that's already out there. And it's nice to know that the help and support is there if you need it. So yeah, thank you guys. This was really nice.
Thank you. We appreciate you. Thank you so much for joining us.
Yeah, thanks for having us.
Guys.